Welcome to the Caregiver's Note, a podcast about childhood disorders and other mental health conditions. I am your host, Nkukone, Dr. Tema, and this is episode 12 titled ADHD and Autism Overlap. This episode briefly explores the overlap between ADHD and autism. ADHD and autism have a lot more in common than not. The stories of struggles from the caregivers of children with these conditions are also quite similar. There are many suggestions as to what causes these conditions, but the common thread between the two is that they are both neurodevelopmental in origin. That is, children are born with these conditions, although diagnosis might be made a bit later. Many caregivers would generally notice suggesting signs much earlier, only to dismiss them, thinking the children would outgrow as they mature. It would take a number of years before a clear diagnosis is secured, especially around school-going age. Just like ADHD, autism is also a lifelong condition. The presentation might be altered according to developmental stages. It was once thought that when a person has autism, they could not be diagnosed ADHD as well. Children with autism would commonly have ADHD or at least a number of symptoms thereof. The reverse does not necessarily hold true. The two conditions also share a similar pattern of other psychiatric conditions that would commonly occur, especially anxiety problems. It is, however, much more common to find intellectual disabilities in children with autism than it is with ADHD. With regards to management, the use of antipsychotic medication like risperidone has also been used in both conditions. For ADHD, however, used in occasions where children with severe impulsivity have shown limited response to traditional medications. Whereas in autism, this medication would primarily be targeting autistic behaviors and sleep difficulties. Treatment in both ADHD and autism requires involvement of various professionals and multi-government departments, including health, education, and social. Some children on the autism spectrum disorder might require specialized school placement. Similarly, children with ADHD, especially those with specific school difficulties, might require specialized education placement, and some would benefit from additional support if in mainstream school. In conclusion, this overlap is emphasized so caregivers are not surprised when an additional diagnosis of ADHD is made in children on the autism spectrum disorder. This could also mean additional medication for those caregivers already anxious on the treatment for autism. Thank you for listening to the Caregiver's Note. Thank you for listening to the Caregiver's Note. If you liked this episode, please remember to subscribe, like, and share the link with those who could benefit from it. Do check out our website at www.nsztema.co.za for more resources, our contacts, and the author's profile. Tune in to our next season when we explore autism.